Hello, I am Dr. Sanjay Kumar Rai. Today's video is for the undergraduate MBBS student, and the video is on the spleen. As we know, spleen is a very important short case for undergraduate final professional exam. So let's start. When you find in your short case a spleen and think that your spleen is enlarged, now you will be asked, please describe your finding. So how will you describe? Say you are asked to examine the abdomen of the patient. So you may start like this. On examination of the abdomen of this patient reveals that the spleen is enlarged. So start here. Spleen is enlarged. So this is the first point. About 5 centimeter from left costal margin in left anterior axillary line towards the right iliac fossa. So this is the first point where you say that spleen is enlarged about 5 centimeter from the left costal margin in the left anterior axillary line towards the right iliac fossa. Okay, so this is the number 1 point. Number 2 point, the spleen is, that is, it is firm in consistency. Firm in consistency. Spleen usually firm in consistency. It may be soft or it may be hard, very rarely. Number 3 point, splenic nose is present. Splenic nose is present. Okay, so number 3, the most important point, that is splenic nose is present. Number 4 point, finger insinuation test. Finger insinuation. Finger insinuation is not possible. That is, get above the swelling is not possible between the spleen and left costal margin. That means insinuation of the finger between the spleen and the left costal margin is not possible. Okay, the very important point here is finger insinuation. And number 5, that is called on percussion. You know, after getting any mass on the abdomen, you have to percuss, and sometimes you have to auscultate over the mass. So on percussion, the percussion note is dull over the spleen, which is continuous up to the right lower chest. As you know, the spleen lies beneath the 9, 10 and 11. So it is 9, 10 and 11 thoracic rib, along the 9, 10, 11 ribs. When it is enlarged, that means it grow beyond the lower rib, that is 11 rib. And if we percuss over the spleen, that means the percussion note will be dull above the thoracic cage, that means towards the lower part of the right chest. So here the point of description. look carefully. Number 1, enlargement, then it is firm in consistency, that is consistency, splenic nose, then finger insinuation and percussion node. So there are 5 points. You have to memorize these: enlargement, consistency, nose, insinuation and percussion. Okay, now some when you will give the description of a enlarged spleen or anything else, you will be asked some related question. So the first question will be, when you will say that it is a spleen, so then the question should be, what are the possibility of this mass? That means you say it is a spleen, but your teacher asks that if it is not a spleen, what are the other possibility? Okay, so what are the differential diagnosis of any mass on the left hypochondriac region? Okay, you have to mind it, you have to understand this question, philosophy of this question. Mass in left hypochondriac region. What are the differential diagnosis or possibility of any mass in the left hypochondriac region? Number 1, splenomegaly. Okay. Number 2, it may be carcinoma stomach. It may be carcinoma tail of pancreas, or it may be carcinoma of left splenic flexure of colon, colon. So colon carcinoma, left flexure of the colon. So these are the possibility. Of course, number 5, it may be mass originating from the left kidney, the mass or enlarged left kidney. So these are the possibility or differential diagnosis of mass in the left hypochondriac region. And now come, when you give the spleen is enlarged, so what are the cause, etiological cause, so etiological diagnosis or etiological differentials of splenomegaly? Okay, so splenomegaly. So cause, what is the cause, what are the cause of splenomegaly? There are a huge number of causes in our textbook, we know, but when you are on your exam board, before the exam board or on the side of your clinical examination bed, you have to put very short list, and you should be prepared at your home. Which cause you will say, you will put before your teacher as the cause of splenomegaly. So look at here, splenomegaly, only 4 cause you will give, that is in perspective of Bangladesh. We are talking from Bangladesh. Number 1, malaria. Number 2, kalajor. Number 3, lymphoma. Number 4, leukemia. Okay, so I repeat again, sorry, I have mistake here. Malaria, kalajor, lymphoma and CLD. You may put this CLD at number 1. So write again here, CLD, malaria, kalajor and lymphoma. So these 4 differential diagnoses you should give as the cause of the splenomegaly, what you identified. Now, with these 4 basic cause, you may add some other cause, like if the patient is young, like young boy about 13, 15 or 20 years old. So with these 4 cause you may add another single cause, that is hereditary hemolytic anemia. I repeat again, if the patient is young, then you put CLD, malaria, kala-azar, lymphoma and hereditary hemolytic anemia, that means thalassemia. And probably your teacher will enter into the topic of this thalassemia. That means you draw your teacher into this trap. Okay, it's a technique. Okay, so if your patient is a female maybe 15, 20 or 30 years, then you should put another entity, that is SLE. Mind it. So then you will say CLD, malaria, kala-azar, lymphoma, SLE, with or without hereditary hemolytic anemia. Okay. Now, in undergraduate at undergraduate level, the spleen which is given at final prof examination is moderate to hugely enlarged, but sometimes you may be given just palpable spleen. Just palpable spleen, or at least you may be asked what are the cause of just palpable spleen. Just palpable at the left costal margin. So what are the cause? You should memorize it. Number 1, entry fever, that means the typhoid. Number 2, subacute bacterial endocarditis. Number 3, SLE. Okay, and very rarely polycythemia rubra vera. So these are the just palpable cause of just palpable spleen, cause of just palpable spleen: entry fever, then subacute bacterial endocarditis, then SLE, polycythemia rubra vera. Okay, so these are the cause. Now, if you are asked when your case is splenomegaly, give single investigation. What is the single investigation for this patient? The single investigation will be CBC with PBF. That's because this CBC will guide. It may be malaria, kala-azar, even CLD. In case of CLD, pancytopenia may be found, as because there is CLD with portal hypertension, and the splenomegaly in CLD is due to portal hypertension. And as we know, this portal hypertension and splenomegaly is actually the hypersplenism, and this hypersplenism is responsible for pancytopenia. And PBF, if this is a case of thalassemia or hereditary hemolytic anemia, so PBF will guide you. So the single investigation will be CBC with PBF. Now, and sometimes your exam may be complicated, like your teacher may ask you, okay, this patient have splenomegaly. Think that this patient have splenomegaly plus lymphadenopathy, that is splenomegaly and lymph node enlargement. What will be the differential diagnosis? Okay, so don't be afraid of this question. Look at here, spleen itself a lymphoid organ, we know, and lymph node, of course, lymphoid organ. So when there is splenomegaly plus lymphadenopathy, think that something there any pathological process that involve the lymphoid organ. So what are the clinical entity we know from our study over the last 5 years? Number one, lymphoma. As because we know lymphoma is the pathology, malignancy or neoplastic condition involving lymphoid organ. So both are the lymphoid organ. Okay, so lymphoma. Leukemia. Here leukemia means actually ALL or CLL, that is lymphoid, lymphoblastic or lymphocytic. Okay, and these two are the main cause of splenomegaly and lymphadenopathy for the undergraduate student. And if you if possible for you, you may put SLE. In SLE, that is the inflammatory process that involve lymphoid organ, and for that why splenomegaly occurs, and for that why lymphadenopathy also occurs. So SLE, the good differential diagnosis. And sometimes of course a viral infection. Not all virus, most importantly is cytomegalovirus and HIV. In the chapter of HIV, we read that there is a splenomegaly, lymphadenopathy. Okay, so it is an immunological insult, immunological involvement of the lymphoid organ as a whole. And we know the disseminated TB. Disseminated TB, everywhere it commit, every organ it involved. So disseminated tuberculosis. So these four, lymphoma, leukemia, SLE, viral infection, disseminated TB, this four is enough. For the advanced student, you may add another one, that is called sarcoidosis. It is actually the same problem, the immunological involvement of the lymphoid organ. Okay, so I repeat again, when for your easy understanding, spleen plus lymph node, that is involvement of lymphoproliferative system, it is called of course lymphoproliferative disease. Spleen and lymph node means there is something lymphoproliferative disease. Here lymphoproliferative disease means lymphoma and leukemia, and these are not the lymphoproliferative disease, but these disease involve the lymphoid organ, SLE, viral infection, disseminated TB and sarcoidosis. And if there is involvement of spleen plus liver, so at that case what should you understand? When both liver and spleen are involved, then you should think that four pathological process. Number one, it might be lymphoproliferative disease. It might be lymphoproliferative disease. It might be myeloproliferative disease. Myeloproliferative disease. Lymphoproliferative disease, as because both are lymphoproliferative, and myeloproliferative disease, that is in myeloproliferative disease the extramedullary hematopoiesis occurs in this lymphoid organ. Number two. Number three, it may be liver disease. In liver disease, liver is enlarged, and secondary to the liver disease, spleen is enlarged, like CLD. Okay. And number four, pathological process which result in splenomegaly and hepatomegaly, that is infiltration. The example of infiltration, most important, amyloidosis. Amyloidosis. It may be glycogen storage disease like Niemann-Pick disease or Gaucher's disease. Okay, and liver disease means here not only CLD, it may be Buerger syndrome. Here a myeloproliferative disease. We know the myeloproliferative diseases are four in number. What are they? Number 1, polycythemia rubra vera. Number 2, chronic myeloid leukemia. And number 3, essential thrombocythemia. Okay. And number 4, myelofibrosis. So these 4 are the myeloproliferative disease. I repeat again, polycythemia rubra vera, it is the pathology related to RBC, okay, and CML, problem with the WBC, and essential thrombocythemia, it is the problem with platelet. So all 3 cell lineages are involved in myeloproliferative disease. Actually myeloproliferative disorder, not disease. And myelofibrosis, actually here the fibrosis occurs in the myelo, that means bone marrow. The bone marrow is filled up with fibrous tissue. Okay. So in myeloproliferative disease, both the spleen and liver are enlarged, that is hepatosplenomegaly found. And lymphoproliferative disease means here lymphoma and leukemia. Here leukemia means mainly AML or ALL, acute lymphoblastic leukemia, and CLL, chronic lymphocytic leukemia. Okay. So these are the cause of splenomegaly, hepatosplenomegaly, and these are the cause of splenomegaly with lymphadenopathy. And previously I said only the cause of splenomegaly, and the differential diagnosis of the mass in the left hypochondriac region. Okay. Now the last point on spleen. Your teacher may ask that when you give that this is the spleen on the left hypochondriac region, so your teacher may ask that why not it is spleen, why not it is kidney. Okay, that means you are asked to give the differentiation between spleen and kidney. So spleen versus kidney. How to differentiate the spleen from the kidney? So your answer will be like this: sir, it is spleen because why it is spleen? Because